My name is Dr. Mustafa Altalibi. I'm the orthodontist here at Sierra Dental, and I've been practicing for 10 years, and 6 years of which have been here at Sierra Dental. I decided to get into the field of orthodontics because I always felt like I wanted to be involved in my patients' lives. Being able to see kids and adults for a cross-section of time of over a year to 2 years, it's definitely a gratifying experience to be able to see them grow, to be able to see them change, be it their confidence with their new smile, or be it their occlusion and being able to chew things or feel more comfortable with their bite. So those are the kind of things that I enjoy. Orthodontics really allows me to merge both the scientific aspect as well as the artistic aspect. It really has everything I've been looking for. The vision I have for the practice is that we want a comprehensive orthodontic treatment for our patients. And because of that, we always want to invest in the latest and greatest technology. We want to make sure that everything we provide to our patients makes treatment more efficient, makes treatment more comfortable, and makes treatment more convenient for them. I've heard of the technology behind the AVO system for a while, prior to even the AVO system coming about. And I was always interested in the technology behind it, specifically with regards to reducing root resorption. And then once the AVO system became available, it became a no-brainer for me. It allowed me to merge two of the things that I wanted to do. One, be it quicker, more efficient treatment, as well as diminishing root resorption in my cases, and so it became the natural thing for me. There is also another thing with the AVO system that I felt was not available in my toolbox, and that's the fact that it allowed me to move teeth that I didn't have direct control over. So these are teeth that, let's say, for impacted canines or other things. Traditionally, I was using other systems that tended to vibrate or move or send certain pulses on the teeth. Those weren't able to move the teeth that are inside the bone the way the AVO system is, because the way the AVO system delivers all of its pulsations is actually inside the bone. Really, the AVO system is made for all cases, and for me, I like it especially in two types of cases. One is the case that has teeth that are still impacted, that I want to help bring in. I find with impacted canines especially, it does take quite a long time to bring them into the arch. Having the AVO system gives me something in the toolbox to be able to bring it in quicker, and today the patient gets the AVO system regardless whenever I'm doing an impacted canine case, just because it makes it that much quicker, that much easier, that much better. I also like it in cases that try to basically save me. When I notice, especially in older patients, where we're trying to move a tooth a significant distance, and I start noticing that the tooth is getting a little sticky, I find implementing the AVO system in situations like that. Patients love it because it moves the tooth faster. I love it because it gets me out of a bind. I have certain cases that I add the AVO system within the price. And those are the cases that I feel like it just doesn't make sense for me to do the case without the AVO system, just because it'll either take too long or just too much chair time for me. So it actually makes me more efficient. Then there are the other cases where I could potentially get the result I want, however, it may take me a little bit more time. Those cases, what we would do is we would present the AVO system as an add-on, and then the patients have the option of reducing their time by adding that AVO system onto their treatment. The patient experience has been great so far. The advantages that we have with the AVO system is it's simple, it's painless. It doesn't feel like it's vibrating on the teeth or anything like that. So in fact, if it weren't for the light that is available on the apparatus, you wouldn't even know that it's on. The patients have taken it in quite well. It also allows us to monitor how often that the patients are using it. Now, the fact that we're monitoring them is another layer of compliance indication that we have. So it kind of forces the patients to be more compliant, because then they know someone is overseeing them. So not only now are they being overseen and in terms of the appointments, but they're also being overseen with how many times they're using the Aveo system. So they tend to wear their aligners more often because of that. The patients that we do have the system on tend to be the more difficult patients in terms of the complexity of the case. And still, I'm very impressed with the results in that they are finishing a lot sooner than we would expect, including one patient who had a tooth crack, premolar, where we had to close the space. And she was in her mid-60s, and yet the space closed up very quickly, and I was amazed at how quickly it closed up because she was using the system. Really, the practice benefits stem from the fact that it allows you to have more efficient treatment. It allows you to monitor your patients to see their compliance. It also allows you to show to both your patients and your team that you are invested in the latest and greatest technology. The patients, when they come to us, they have a certain expectation that they're receiving the top care. And by having all of these tools, we're showing them that we're investing in the top care. I would say that the AVO system does help move the teeth quicker. The science is there. It also helps reduce root resorption, and the science is also there. For me, before integrating something into my clinic, I always want to make sure that it's backed by science. And that's why I like the AVO system. It's an easy integration into the office. There isn't too much that you need to change within your the way you function. And the patients do appreciate having that option, even if you want to include it as an add-on.